Hi, my name is Dr. Barry Make. I'm a professor of medicine at National Jewish Health. I'm going to talk to you today about expanding the definition of COPD. What do you mean expanding the definition? There's a definition already. Don't confuse me. Well, I'm not trying to confuse you, but what we're trying to say is that the definition of COPD does not incorporate all the patients you see in your clinical practice. You see patients who are cigarette smokers who don't have COPD by spirometry, but we still need to think about those patients because they have symptoms. What do we do with those patients? How do we classify them? I hope this will help. So here are my disclosures. This is a CME activity. It's not funded by any pharmaceutical company. I'm not talking about drugs or devices. So the usual definition, the universal definition of COPD, the international definition of COPD was developed by the GOLD Committee. That's the Global Strategy for Diagnosis, Management, and Prevention of COPD. And they have 5 points here. The second and third are the most important because that's really how you diagnose COPD. Patients have to have persistent respiratory symptoms. That means not just with a cold or a sore throat or a bronchitis or a flu, but persistent over time, shortness of breath, cough and sputum production. And not all patients have both of those, but they may have one or the other and may have wheezing as well. Also, the disease is characterized by persistent airflow limitation on spirometry. Now, by persistent, we just mean that after a bronchodilator, it doesn't go away, it's still there, but you need to diagnose that on spirometry. And that's not easy because we don't always have a spirometry available to diagnose that. So what about the expanded definition of COPD? Well, I want to talk to you about COPDGene, which is a large a national study in the United States funded by the National Heart and Lung and Blood Institute. We've had 10 years of longitudinal progression findings in our 10,718 subjects that were enrolled. The goal of the study is to determine different subtypes of COPD. Well, what do you mean subtypes? Well, some patients have cough and phlegm and some don't, for example. Some patients are more short of breath than others. Some patients have emphysema on their CT scan, but not all patients with COPD have emphysema. You may find emphysema on the CT scan if you did a lung cancer screening CT scan or the patient's been in the emergency room for some abnormality and they wanted to do a CT scan, and you find it maybe is an incidental finding. The goal of the study is also to find the genetic basis of the different subtypes of COPD so we have better ways to diagnose, treat, and prevent the disease in the future. So at enrollment, our patients were 45 to 80 years of age. And we really had very little in terms of inclusion criteria. The main one was they had to have a 10-pack year history of cigarette smoking or more. That's really the only thing we looked for. We wanted to include African Americans as well as whites, and we did. 1/3 of our population is African Americans. We have about equal numbers of males and females. So based on this study, this is how we defined the different COPD categorization we're talking about here, COPDGene 2019. Really, this is not a population of patients with COPD, it's a population of current and former cigarette smokers. Because we didn't enroll patients based on their spirometry, we just enrolled them based on the fact that they were cigarette smokers now or in the past.